Well, there are some clear things that could happen pretty quickly. There are some intriguing studies looking at, in the third world, simply looking at whether or not you give people a gas stove with propane gas versus burning dung. That probably, for many people, is a clear environmental measure that will make a lot of difference. And that's actually in randomized placebo-controlled trials right now to begin to look at that. All of these problems are intertwined. So, for instance, for people with asthma in the inner city in the United States, an environmental intervention likely has to be multiple. So if you have smokers in the home, and that's another big issue, secondhand smoke can be an issue, high efficiency particulate accumulators or HEPA filters are probably a useful thing, but that's done in conjunction with controlling humidity and controlling whether you have rodents or cockroaches or house dust mice in the home, because those are allergens that promote asthma. But it's not one thing in isolation, and what's going to be an important intervention for you may not be the same intervention that I need, depending upon, but that's at the level of the individual, between them and their doctor and their health providers. Societally, we still know that there can be changes that are made. In the late 80s, in the Utah Valley, there was a strike of a coal-burning industrial facility. And what was pretty clear is that during the strike year, coincident with decreased particulate matter in the air, there was a marked decrease in hospitalizations due to respiratory tract admissions in January. That's important because I think many people looking at those data would have thought that, well, it's just January's cold and flu season. Well, in fact, when you shut down the plant, coincident with that year during the strike, there were less hospitalizations, and then when the strike was resolved, the plant was operating, everything was going back to normal, people went back to the hospital again. So that's a clear signal that, okay, now I'm not saying we should shut down everything, because frankly, I like stuff, and I think most people, it's all about balance more so than one's bad and the other's good. Another example in the U.S. was during the 1996 Olympic Games. So in Atlanta, there was significant concern, and frankly, in every Olympic Games in the modern era since the 1990s, there have been significant concerns at site cities about air pollution. Why is that? Because bad air impacts physiology. You impact physiology with people who are using a lot of physiology, which are world-class athletes. It's not that good. So what happened in Atlanta, there was very real effort made temporarily for the Olympics by the city management to change traffic patterns and to change how people drove in and out of the city. What they found was that when compared to the immediate before and after Olympic setting, during the time of the Olympic Games, ozone levels were actually diminished, and of all the pollutants, ozone was the one that was the most impacted. But frankly, in the summer, it was probably the most important as well. And then people went back and they looked at hospital discharge and economic databases to see if hospital usage was different. What was very clear is that admissions to hospital or discharges from hospitals due to asthma-related diagnoses were clearly diminished during the time that the ozone was low during the Olympic Games. Other diagnoses that were not related to that, heart attacks and traumas and other things, those were not diminished. So it wasn't that there was a general decrease in ER use. It was relatively specific to the asthma signal, which you could argue would be more affected by ozone. There are a number of situations where we can demonstrate that with more pollution there's more disease, and when there's less pollution there's less disease. So there are things that can be done. What it comes down to is what's the balance between having enough necessary industry and having air and environmental factors writ large that are health promoting or at least not health endangering. That's the national discussion we have to have. Frankly, air pollution in the United States has improved substantially over the past 20 years. Unfortunately, I think because of other factors of human health more recently, we have more people with asthma, we have more people that are overweight, we have an increased number of people who are perhaps more susceptible to the effect of pollutants, and we're also finding that some of the pollution effects are subtle enough that it may take a little bit of time to see where it is.